Thank you, esteemed chairpersons. And I will start with this beautiful words that is after dinner walk a while and after supper walk again. So this is what I'll be discussing why it is important to walk or to do exercise in the postprandial states and how it mitigates the postprandial spikes. So this is what I'll be discussing the strategies to mitigate postprandial hyperglycemia. So how exercise reduces postprandial glucose, do we have some evidence as regards to doing only light exercise, because most of our people they are not amenable to doing high intensity exercises. So do we have some evidence for that? Then timing of exercise, so how does the body relates to the circadian rhythm and what would be the optimum time to perform an exercise? So what are the types of exercise which are fruitful for the control of postprandial hyperglycemia? What are the specific benefits and what could be a personalized exercise prescriptions? Because one exercise prescription doesn't fit with all of our patients. So first and foremost, we have always been taught all across our life that fasting in the empty state is the best. But when we are talking about diabetes and control of postprandial hyperglycemia, I think the post meal we have got a better evidence as regards to post meal exercise that it outperforms as regards to control of the postprandial spikes. So we have a study by Schinter and colleagues, and they detected that increased carbohydrate use but decreased fat turnover if exercise was applied after meal ingestion compared with pre-meal exercise. Then they did a very interesting study that was with indirect calorimetry and labeled glucose. This study found that exogenous glucose was a main source of energy during exercise in the postprandial state, whereas muscle glycogen and lipids were used during exercise in the fasting state. So these results suggest that beneficial effects of post-meal exercise might be induced by shift in substrate utilization and the insulin-independent use of glucose directly after ingestion. So that is the point, that if we are doing a exercise in the fasting state, we are using more and more of lipids. But if we are going for a postprandial exercise, you are using more and more of glucose. So then comes what should be the time, what should be the time when we should be doing the post meal exercise. So that is, there is a difference between the healthy individual and a person who is having already having diabetes, because in healthy individuals the glucose peaks around 30 to 60 minutes after eating, and in people with diabetes the peak glucose levels reach considerably higher values, often occurring between 60 and 120 minutes after a meal. So initiating a postprandial exercise before the peak glucose levels occur, that is approximately 15 minutes in healthy individuals and 30 minutes in people with type 2 diabetes. So basically we want to mitigate the postprandial spikes. So in healthy individuals we ought to do a bit earlier, and in people with diabetes we have to do it within 30 minutes. So what are the advantages? So if you exercise for healthy individuals, we have to do it within 10 to 30 minutes after a meal, utilizes glucose from the meal, enhances insulin sensitivity and glucose uptake. And for people with type 2 diabetes, exercise within 30 minutes post meal improves glycemic control, enhances insulin action and reduces glucose spikes. And the exercise intensity and duration, that we'll be discussing more in detail. Now coming to the circadian rhythms. So how do this fits in? What time is the best for doing an exercise? Whether it is a morning exercise, afternoon exercise, evening exercise. So we have some evidence for this. That may not suit to all the people, but we have got the evidence, and the evidence is that the core body temperature tends to be at its highest between 2 p.m. and 6 p.m. and exercising during this time is optimum for best performance. So this is what the studies say. The metabolic functions are enhanced because of the increased core temperature, extensibility of connective tissue is increased, and the conduction velocity of the action potentials is quicker. So that is the reason why this particular time is good, and we have evidences as regards to the athletic performance. When it was performed, it was 3 to 15% higher when it was performed in these times. Then comes a point, because most of the people may not be amenable for an afternoon exercise, or the time that they have, that does not allow them to do and perform an afternoon exercise. So then this is a very interesting study. So if we are doing it in the morning, So what we need to do? So they said this is a very interesting study by Miriju et al. And they showed that a 10-minute warm-up period while listening to neutral or self-selected high-tempo music through headphones. So that is one way we can warm up, and then morning exercise, then we can delete this time to day deleterious effects of the short duration maximal exercise in the morning. So if you are doing it in the morning, so we have to do a warm-up, a 60-minute exposure to warm and humid climate conditions, active warm-up protocols, 2 to 4 weeks of intermittent fasting conditions, a training period of at least 5 weeks performed in the morning. So that could negate this advantage that is being provided to the afternoon exercise. So basically we are talking about warming up or a good exercise training prior to we start doing this thing. Then late evening exercise. So late evening exercise, the problem would be that the sleep quality will be hindered. So whenever we are thinking about late evening exercise, we are talking about less vigorous exercises such as yoga, and avoiding high intensity exercises is suggested. So that is the reason that basically we do not want to disturb the sleep. Morning exercise, what are the advantages? It's more effective at metabolizing sugar and fat during the morning time. So that may be effective for reducing weight or a good control for diabetes. Then we are coming to these are the chronotypes. So we have two type of people. Some are late risers, some are early risers. So early risers are the larks, which are the lower ones, and the owls are the those who stay awake till night. So larks, morningness, what we call in the terms of the chronotypes, it is called morningness chronotype, tend to experience morning peaks and evening troughs in circadian rhythms, whereas owls, that is the eveningness, experience the reverse. Therefore, a lark would be better suited to morning exercise than an owl. So they are not generalizations. They are just some points to ponder, because no two individuals are the same, and this also may coexist. The lark and owl phenomena may also coexist. So exercise duration, all say about 40 minutes of exercise at any intensity improves post-meal glucose management. High intensity exercise can cause issues. Detailed guidelines are not very clear. Optimal durations are 30 to 60 minutes, and light to moderate intensity is beneficial. Even short durations are effective. So if he is not able to do the high intensity exercises, then light to moderate intensity is also good. High intensity exercises like stair climbing, that can be done in the office environment also, is also known to reduce the post meal glucose levels due to intensity and energy demands. Then aerobic versus resistance training. So that is also this, which is better. So aerobic exercises tend to lower post meal glucose peaks more effectively, while resistance training helps maintain stable glucose levels. So good would be a mix of both aerobic and resistance exercises. But if you say for post-meal hyperglycemia, which I have been asked to talk about, so aerobic exercises outperform resistance training. Personalized exercise prescriptions, they are very, very important, because we have to understand everything about the patient before giving giving an exercise prescription. All things are to be incorporated, the comorbidities, everything has to be taken into consideration when we are giving an exercise prescription. Then this is also very interesting that these are very interesting things like leg fit getting. So this is performed at regular intervals during postprandial periods, can effectively attenuate the postprandial glycemic and insulinic responses in obese individuals. Simple exercise, most of us are habituated of this. And then soleus push-ups. So this soleus push-up is also very interesting thing which can be done. So they can also help in mitigating the postprandial hyperglycemias. So alternative exercise I have already told you. So if you can't do anything, then neuromuscular electrical stimulations. So that also can be done. So that is also an alternative. A bit about pre-meal exercise. So what could be the benefits? The enhanced insulin sensitivity, fat oxidation, reduced risk of hypoglycemia, and lower gastrointestinal discomfort. So these are the reasons why we can opt for a pre-meal exercise. Benefits of post-meal exercise: reduction in postprandial glucose levels, improved glycemic control, utilization of exogenous glucose, synergistic effect with medication, and tailored exercise choices. Then we have got studies where we have seen that whether this post-meal exercise has a synergistic effect with the medications. So this very interesting study by Erickson et al. They showed that the diabetic individuals under metformin treatment have a significant reduction in the glucose peak after an exercise session started 30 minutes from the beginning of the meal. So we can have a synergistic effect with the metformin because we are increasing the insulin sensitivity. So these are the improved glycemic control. So a good exercise would be that depends upon the individual's choice or the conditions that permit him to do it. But for the postprandial hyperglycemia spikes, postprandial exercise would be a better option. But if he is not amenable to that, then we can go for the pre-meal exercise also. So I conclude my talk. Exercise such as 20 minutes of walking has an acute beneficial impact on postprandial hyperglycemia when undertaken as soon as possible after a meal. Longer intervals between eating and existing and exercising weaken the effect on glucose levels. Exercise prior to a meal does not blunt postprandial hyperglycemia, and this effect seems especially relevant in sedentary changes during working hours or in the evening in which micronutrients are provided consistently through digestion. So I've already told you that we can incorporate these exercises in your working routine, like climbing stairs and these fit getting and the soleus push-ups. And post-meal exercise minimizes glycemic excursions in healthy humans and patients with type 2 diabetes, and these could contribute to overall glycemic control and long-standing health consequences. So earlier we used to say after dinner rest a while, after supper walk a mile, and now it would be better to say after dinner walk a while and after supper walk again. So thank you for patient hearing, and I'm open to questions.